This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Wednesday, April 8th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future, as we, out of an abundance of caution, reduce our staffing at our VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. British officials say Prime Minister Boris Johnson remains in stable condition on Wednesday after spending a second night in the intensive care unit at a London hospital for coronavirus treatment. Junior Health Minister Edward Ogar says Johnson is resting comfortably and he's in good spirits. Britain, which has been under a COVID-19 lockdown for about 2 weeks, is reporting 56,000 confirmed coronavirus cases with at least 6,100 deaths. Germany on Wednesday became the fifth country to surpass 100,000 cases of COVID-19, joining Italy, Spain, France, and the United States. America has the most confirmed cases of the virus with 400,000, more than double the number found in any other nation. New York City remains the nation's biggest hotspot, reporting more than 700 new deaths on Tuesday. Worldwide, the coronavirus pandemic has infected over 1.4 million people, killing at least 82,000, and while sending the global economy into a deep abyss. Now to Africa, where Egyptian officials say in an effort to slow the spread of COVID-19, they're banning any public religious gatherings during the holy Muslim fasting month of Ramadan, which starts in 2 weeks. Egypt is reporting 1,300 cases of the coronavirus and more than 250 deaths, according to Reuters. In South Africa, the nation's main health workers union is fighting the government in court over a lack of personal protective gear for its frontline staff. South Africa is reporting over 1,700 cases of COVID-19 and 13 deaths. African governments are calling for $100 billion in assistance, including support for a moratorium on all external debt and eventually some debt write-offs. Ghanaian Finance Minister Ken Ofori-Atta says China must do more to help ease the debt burden of African countries facing economic calamity from the coronavirus pandemic. China says that it recognizes that developing countries face a greater challenge, but it did not mention any specific debt relief measures that it would implement. A leading global health fund is asking international businesses and governments to provide $8 billion to support development and production of COVID-19 tests, drugs, and vaccines. British-based Wellcome Trust says the initiative, dubbed COVID Zero, is aimed at the private sector. An initial $8 billion by the end of April would be enough to develop new COVID-19 tests, drugs, and vaccines, and to begin scaling up production, according to the fund. Wellcome says that $2 billion of the initial $8 billion needed would be used to help poorer and more vulnerable countries to build a stockpile of masks, medicines, and other defenses against future outbreaks. South Sudan has announced its first confirmed coronavirus infection, a United Nations staff member, becoming one of the last African countries to report a confirmed case of the virus. But years of civil war and low funding have left the nation with a fragile healthcare system, raising fears that the virus, if left unchecked, could quickly spread. Sheila Pony reports from Juba.
Before closing its airports and borders last week, South Sudan had been taking some coronavirus prevention measures. But frequent international traffic from the United Nations and other aid groups put the country at risk, and a UN staffer was the first confirmed infection. South Sudan's first Vice President Riek Machar is leading a coronavirus task force to stop the virus from spreading further.
The high-level task force has put in place relevant public health measures over the past 2 weeks. Social distancing, as you can see between us now, social distancing is the only way we can minimize the risk of contracting and transmitting the disease.
But on the streets of Juba, social distancing is not an option for people struggling to earn a living.
In fact, it will be very difficult for a country like my country, South Sudan, because here we are lacking a lot of things. In fact, like water, we need to gather some time to collect some water, and then market even. We are going to the market, and then there is a lot of crowd there, so that is our only source of getting. So it will be difficult for us.
China, where the virus began, is heavily invested in South Sudan and has hundreds of peacekeeping troops serving with the UN mission. In a February interview, the Chinese ambassador vowed to support South Sudan's fight against coronavirus.
For the years, we have been building the capacity of the medical teams here. And so far, there's a large number of people already received the training in China. And we are supporting the building of the disease control system in South Sudan.
But years of civil war in South Sudan, Africa's youngest country, has left healthcare poor and underfunded. South Sudanese officials admit there are only a few ventilators for a population of 12 million.
I want people not to be panicked with the information about the coronavirus. 2, I want the people to be vigilant, to give us any necessary information concerning any suspect that is happening in the country.
To force some social distancing, South Sudan last week imposed a nighttime curfew and closed schools, churches, and mosques. But officials say more support is needed from international partners to shore up its healthcare system and prevent the coronavirus from a country still scared from years of conflict. Sheila Poni for VOA News, Juba.
The White House is projecting close to 82,000 COVID-19 deaths in the United States by early August. This number is a slightly less grim figure than earlier outbreak models indicated. Experts say the government's transparency is essential in communicating with the public during this health crisis, but warn that pandemic modeling is never precise. White House correspondent Patsy Widakuswara explains.
A harrowing sight in New York City. Medical workers transporting bodies to refrigerated trucks repurposed as temporary morgues as COVID-19 deaths climb up.
This will be probably the toughest week between this week and next week. And there'll be a lot of death, unfortunately.
Assuming the country implements full social distancing until end of May, the White House Coronavirus Task Force projects close to 82,000 COVID-19 deaths by early August. The model predicts the U.S. may need fewer hospital beds, ventilators, and other equipment than previously projected. However, health experts warn against early optimism and say it's best to prepare for worst-case scenarios.
That serious talk helps all of us, both professionally and personally, to think seriously about this issue. It helps us prepare psychologically for what's ahead.
For their coronavirus modeling, the White House reached out to a number of universities, including the University of Texas at Austin. Lauren Myers, head of the university's research team, underscores that pandemic modeling is almost never precise and that these projections are not like weather forecasts.
When you forecast a tropical storm, there's nothing you can do about changing the path of the storm. There are things you can do to protect yourself, but you can't change the course of the storm. When you project that an infectious disease outbreak could lead to a crisis in healthcare or lead to many, many deaths, there are actually measures you can take, things you can do, especially if you act early enough.
Projections rely on good data, and not all countries have the tracking capacity nor the political will to record cases accurately and transparently.
I think that lying about numbers, suppressing science, suppressing doctors, censoring the media, this is the absolute wrong time to be doing that.
South Korea was one of the worst hit countries in the early stages of the pandemic, but has been praised for its effective, aggressive response. That includes a swift implementation of mass-scale testing and consistent, transparent messaging to the public throughout the crisis. Patsy Widakuswara, VOA News.
In the fight against the COVID-19 pandemic, one sign that social distancing measures may be working is that people's temperatures, a symptom of the virus, are dropping in some cities across the U.S., according to a smart thermometer company. The data could give health officials an early look into how the virus is progressing. Michelle Quinn takes a look.
Okay, like this.
A smart thermometer connected to the internet doesn't sound like something that can help in fighting COVID-19. The user's temperature reading is uploaded to a database where the thermometer company tracks fevers. But Inder Singh, the chief executive of Kinza Health, which makes such a device, recently looked at his fever data in places with strict social distancing measures.
When you start implementing aggressive social distancing activities, stay at home, shelter in place, even bar and restaurant closures, within 3 to 7 days, you see the fever curves level off and start dropping. And that's because you're breaking the chain of infection.
About 2 million people in the U.S. use Kinza thermometers, with more than 100,000 temperatures taken daily. While the company's predictions have not been peer-reviewed, Kinza says its data provides a window into atypical fevers in the U.S. Singh says his data suggests that in some places the number of fever cases is leveling off, but still remains higher than normal. That could signal a big problem.
So the worry is that there are small groups of people or there are small communities of people in which viruses are just continue to be passed around. And that could act as a reservoir, that could act as a hiding place for COVID-19. And after we relax those social distancing activities, it could start spreading again.
There's a race on to predict where the virus is going, what measures are working, and when it's safe to open society again. This smart thermometer's fever data may be one signal for health officials scrambling to figure out what to address next. Michelle Quinn, VOA News, San Francisco.
While many of those who have died or been infected by COVID-19 have been the elderly, the novel coronavirus also has struck the young. Otherwise healthy younger patients are being hit hard. VOA's Mariama Diallo reports on 2 survivors, a 33-year-old in Italy and another 44-year-old in the Philippines.
Waving from his apartment window where he's recovering, Andrea Napoli, a young Italian lawyer, was in perfect health, but things changed quickly.
I remember having a normal hearing in court without any kind of symptoms the day before. The same morning I had breakfast, lunch, and then suddenly I felt sick.
Napoli, an active water polo player and jogger, developed a strange fever, dry cough, and felt out of breath. He was hospitalized, then the oxygen in his blood decreased sharply, and he was transferred to the ICU.
I didn't think it could hit me too, because I've always been very careful with gloves and masks.
At this hospital, doctors managed to stabilize him and move him to a sub-intensive care unit. Then he was attached, without intubation, to oxygen for the next 9 days non-stop. From Italy to the Philippines, where 48-year-old husband and father Carlo Navarro recounts his battle against the coronavirus.
The scariest moment was maybe it started on the 4th day when people who got admitted at the same time as me, they started dying.
He got infected while visiting Japan with his wife and daughter in late February. The hardest for him, he says, was not being able to have family at the hospital.
We were really in isolation. It's a negative pressure room. So my wife and I had video calls almost every hour.
Navarro survived, but otherwise healthy young people around the world have come down with COVID-19 and died. This has surprised doctors and is serving as a warning that anyone could be struck down by the coronavirus. Mariama Diallo, VOA News.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, a Ghanaian technology social enterprise is using homegrown technology to help educate kids in rural schools. We'll be right back after this short break.
chimalata echibwana chimalata ungakhala pabwino boyipa pamayitana chibwana chimalata ukakhala pantchito ulova umakodola chibwana chimalata ukakhala pabanja umbeta umayitana.
On the next Straight Talk Africa, the deadly coronavirus is spreading across Africa, causing anxiety and fear. Join me, Linor Moudou, and a panel of experts to answer your questions about COVID-19 and to distinguish myth from fact on a special edition of Straight Talk Africa.
Just a few months ago, a California woman named Princess Dumebi worked as a street performer on Hollywood Boulevard. However, after the COVID-19 pandemic hit the state, she, like hundreds of thousands of other people in the country, lost her job. But she refused to stay at home doing nothing. Instead, she started cooking to feed the homeless. Angelina Bagdasarian reports. The story narrated here by Anna Rice.
These days, Hollywood Boulevard looks more like an off-hours movie set than a real street. Restaurants are closed, no tourists are in sight. The only people still seen on the Hollywood Walk of Fame are the homeless. They have nowhere to go. Until recently, Princess Dumebi worked on the boulevard as a street performer, dressed as a superhero. These days, when there is no one to entertain, she remains a hero, a real one.
By the time the quarantine started, my mind was on the homeless people. Okay, I could go into my house, my apartment, and just stay there and eat. How about the people on the street? Who's going to feed them? Hollywood, I don't know, maybe thousands, maybe even millions of people come here every week or more than, every day. And they literally feed from them. Like the things they drop in the bins and all the stuff.
Now that the streets are empty, there seems to be no food left for the homeless. After Princess Dumebi, like thousands of others, lost her job, she started cooking for those who had nowhere else to get food from and brought it to the boulevard.
I try to avoid meat because not everyone eats meat. But I make sure they have the vegetables and then they have fruits. I try as much as possible to get the organic food. Mostly I'm up to between 50 and 60. Yeah, every day.
Dumebi is from Africa. She came to California chasing her dream to become an actress. And though she never succeeded, she couldn't leave the Hollywood Boulevard.
I work here. I get most of my income here, selling tours, welcoming tourists, taking pictures, and then getting tips. So I make a lot of money from here. I make decent amount of money.
She says she lives on what she had managed to save, but does not lose hope and optimism. Dumebi believes hard times are just a test, and it's much easier to pass when people help each other.
The management of the apartment where I live, the apartment complex, they've given us some concessions, like if we're not able to pay our full rent, they're giving us a payment plan but within 6 months, should be able to pay up. So I'm grateful. So with that, I'll still be able to feed myself and feed some more people. The minimum I could do for them is food.
Dumebi says the police are understanding and allow her to bring food to the Hollywood Boulevard for the homeless. And she believes that if amid the panic and crisis, everyone does even the smallest thing trying to help others, the world will become a much better place. For Angelina Bagdasarian in Los Angeles, California, Anna Rice, VOA News.
Amid coronavirus fears, Wisconsin voters went to the polls Tuesday after the state Supreme Court reversed the Democratic governor's postponement of the election. As VOA's Michael Sullivan reports, disputes over the voting process foreshadow battles ahead of November's presidential election.
Facing long lines and fewer polling places, Wisconsin voters tried to practice social distancing as they selected judges, local officials, and for Democrats, their preferred presidential candidate. This after Democratic Governor Tony Evers reluctantly postponed in-person voting. but was overruled hours later by his state Supreme Court. In a separate case, the U.S. Supreme Court blocked an extension of the deadline for mailing absentee ballots, both questions pitting conservative against liberal justices. Although justices are nonpartisan, their rulings can reflect party differences.
Each party wants to determine the election rules. Democrats favor a broader franchise. They favor voting by mail so that more people have a chance to vote easily. Republicans want to reduce the franchise to the level that will support Republican candidates.
That means reducing the number of minority and young voters who tend to vote Democratic. Some voters wanted the election postponed because of the pandemic.
I saw a lot of elderly voters, people who are high risk, out there today, and everyone was taking as many precautions as they could. We were 6 feet apart, but you know, we don't know what we don't know about this virus at this point in time, and it's really scary.
The U.S. Supreme Court, in a 5-4 ruling, said that changes in the voting so close to the election could not be justified. In a dissent, Justice Ruth Bader Ginsburg spoke of the health risk and said tens of thousands of voters could be disenfranchised. There may be similar battles ahead.
We may see a state-by-state kind of hand-to-hand combat in terms of what the rules are that prevail in each place. And because our electoral system historically and also today has often been left to the states and to localities, that creates all sorts of potential mischief.
It could be several days before all of the Wisconsin votes are counted. The battle could play out again, especially if, as some predict, another wave of COVID-19 sweeps through before the November presidential election. Mike O'Sullivan, VOA News, Los Angeles.
In our tech report, education is a fundamental tool to alleviate poverty in many African communities, and having access to a computer or library can be a challenge. But in Ghana, it's now easier thanks to Tech Aid. This Ghanaian technology social enterprise has developed a different way to deliver instructional content to rural schools by using a homegrown technology dubbed Asanka. Africa 54's tech reporter Paul Ndiho spoke with Kafui Prebi, CEO and founder of Tech Aid in Accra, Ghana.
We're trying to change how education is delivered, especially in schools and also out of school curriculum, making it affordable for people, especially using technology, making the classroom exciting.
And how long have you been doing this?
Well, Tech Aid has been doing this for about a decade, you know, and we try to do this by using technology for the teacher and also the learner. Digital content is very expensive to access in the parts of the world where internet is extremely expensive. So what we've done is bring one of our innovative products to address that solution, which is Asanka, which is all subjects and new knowledge access. And you can find it at myasanka.com. We also have tried to digitize the Ghana Education Service curriculum and put it on the Asanka. So once you put it in the classroom, you convert the classroom or the library into a multimedia space. You can connect with your phone, your tablet, desktops, and just to make the classroom lively and interesting. Currently, we put about over 200 devices ever since we started the trial, and all those devices are gone. We're getting positive feedback. Our thought is to impact education.
Access to internet is still one of the most expensive things here. And I'm surprised to know that you guys have figured out how to actually deliver this without using the actual internet.
We realized that we've established a lot of technology centers across the country, and we had to go and upgrade the system every time there was a need for new software or everything. So we thought of, so all this content we put on the desktops that we install across the country, why don't we have a digital device where we can put the content? And where there is no internet, people can access the content. So we figured out that access to internet was crappy, it was pricey, and it wouldn't get to the rural areas very quickly and very soon. So we thought of how do we get this internet into those areas? And so we got all the relevant content and put it in the classroom. Now you see teachers connecting to it, you see parents asking that, can we have their Asanka devices at home? So instead of internet, which is pricey, our children have access to educational content.
Is it like a box?
It's 1 watt. device. It has a small computer board in, and we did the programming ourselves. We got all the content and put it on it and made it in such a way that the UI, it's easy to use. So anybody who just has used a phone before, especially a smartphone, can connect. It's just like a Wi-Fi device, and they can access content, they can learn, they can take exercises, they can take quizzes, and so on and so forth.
And this technology was developed by your group here?
Yes. We had a little computer boards which are available online, and then we did all the technology around it, programming the software and getting the content to fit in the software. And we work with the Ghana Education Service curriculum to make sure that it matches and is teaching directly towards what the Ghana Education Service or the ministry requires the children to learn.
In terms of impact, how much impact have you had on the community, on the school system?
We've set up not less than 100 locations across the country, and if we're talking about 2,000-3,000 people accessing our computer labs, and in places that recently we've installed in Tamale in Ghana, we're having a pass-through rate of about 4,000 children in a week accessing our 56-seater lab, because we help to program around the usage of the facilities. So if you're talking an average of about 2,000 to 3,000 times 100 centers, we're talking 300,000-400,000 people who have accessed and utilized our facilities.
Is your background in education? How come you came up with a program to help people?
I had a passion, and through my work as being a professional teacher, I won 2 awards to be the best teacher. So I love to impact people. Right. And through that process, I found out that technology was not available in many places to make learning easier and to make it interesting. So then we found a tech aid to be able to work with other people to expand the vision.
Been in the tech space for a while now. Where do you see the technology here in Ghana or in Africa as a whole?
I feel that we've leapfrogged a lot in terms of technology, because we didn't have good technology schools in Africa to be able to help us grow. The MITs of the world were not here. However, I think the African student or the technology passionate person is hungry, and therefore you are seeing a lot of things that come out of Africa. I think we've moved forward. We are learning using the internet where it's available, and we are trying to challenge the world. Our applications are currently being utilized. They are on Google Play Store, they're on iOS, which didn't used to be the case in the past. Everything you consume was not African. But now you have African apps, you have things that are homegrown that you can work with. So the tech space has moved forward. It's getting better.
That was Africa 54 tech reporter Paul Ndiho speaking to Kafui Prebi, CEO and founder of Tech Aid. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.